It's not going to be something that's going to be resolved in the next few days, even if Shanghai were to mass produce amounts.
A problem happening more than 7,000 miles away. ABC News reports strict lockdowns due to COVID-19 in Shanghai have lasted months, impacting production. Now, a life-saving liquid dye produced at GE Healthcare's plant in the city is creating an international critical shortage.
There's really two types of contrast in the world. Probably 60% of people use this one by GE, and 30 to 40% of people around the world use the other type. And it's a one or the other.
Ashley Montgomery Yates is the chief medical officer at Good Samaritan Hospital in Lexington, Kentucky, and she says contrast media like Omnipaque and Visipaque are used in CT scans and more to help highlight possible issues. Well, with GE Healthcare's main facility getting tied up in the lockdown, that meant a critical shortage for hospitals even here in the Bluegrass.
How do you get it to America? How do you get it to the hospitals? GE's now flying it over from China instead of boating and all those sorts of things to try to expedite the process.
She notes they're starting to ration their supply. From what they could use a whole bottle for, they're now splitting into 10 milliliter increments. Holly Poindexter from Jeffersonville, Indiana, has a 6-year-old son named Coy who suffers from epilepsy. Some of his tests require contrast media, and Poindexter says they've seen them done with and without it.
He had done the order with and without contract. He wanted both.
MRIs use another form of contrast that is seemingly not being affected right now. However, Poindexter says that it is scary to know hospitals here have to rely on other countries for this dye that can be life-saving in many cases.
I think we could absolutely have more stuff made here to where we don't have to rely on so many countries.
I spoke with representatives at U of L Health, and they tell me they're actually not being affected by the shortage. However, just across the street at Norton Hospital, they say they are, but they're working to conserve their stock so there's no disrupt in patient care. For those that are affected by the shortage, they're wondering when will the supply chain go back to normal.
We've been told is probably by July 1st that at least the production will be up to 100%, but maybe not the supply and the distribution part.
For Montgomery Yates, she says they're having to even reschedule some patients who may not be at major risk, saying they just want to make sure they have enough for the moments that may not be expected. In Louisville, Ford Sanders, WHS 11, on your side.